And BioNTech struck a deal with South Africa's Biovac Institute to process and distribute over 100 million doses of their COVID-19 vaccine annually for the African Union beginning in 2022. This would make it the first company in Africa to produce Pfizer's COVID-19 vaccine. Biovac CEO Dr. Morena Makhoana joins us now to talk to us about this. And of course, you can be a part of this conversation tonight by sending us your WhatsApp questions and comments to 072-110-5584. Dr. Morena, good evening and thank you very much for your time tonight.
Good evening, Tabo.
Well, I mean, the question is always asked, why is it that the continent is last in line when it comes to the supply of vital things such as vaccines? And of course, we are seeing this partnership and it's beginning to almost give us a sense of hope that we are getting closer and closer to that realization. How significant is this particular partnership?
Yeah, thanks, Tabo, and a very relevant question. I mean, before I come to the partnership in itself, I think your question is very pertinent about, why are we in this position as Africa in terms of vaccine manufacture? And I think, the question is being highlighted now because we're having a pandemic, but like anything, the question is, what is it that was there or not there prior to the pandemic, and why are we in this state? And I mean, the answer is, there's a short and a long version to it. I'll stick to the short version of it. A lot of African countries are extremely donor dependent, which essentially means that they do not purchase vaccine out of their own fiscus. So if we use South Africa as an example, the fiscus as in government, through Treasury and Department of Health budget for routine vaccines, and that gets paid out of taxpayers' money, and we in this country give vaccines for free. So there is a direct market, if I can put it that. Most African countries, because of the economic level that they are in, fall under what we can term donor countries, which essentially means that they get sponsored heavily for the purchase of their vaccines. And they get vaccines from UN-related agencies like Gavi and WHO, who have a mechanism of purchasing vaccines. And those in turn get funding from big countries like the G7s and the Bill and Melinda Gates Foundation. So, there's a saying that if you want to find the market in Africa, then go to Copenhagen, which is where the UN agency is responsible for procurement of vaccine. So with that background, Tabo, what it essentially means is that there's been little incentive for companies to come naturally and to put facilities on the continent and say, well, I want to put it because, there was no incentive. So, anybody could supply Africa from, India, US, Europe. And so there was actually no burning need to manufacture vaccines here.
So I mean, in a sense, you'd say it's the production economics that are at play here. And we'll get into a little bit of the details of that. But let's talk about what the pandemic has then revealed to us.
Exactly. So in the normal course of business, we've been in the vaccine world for a while, and people will say, but does it really make sense? I mean, India can manufacture so much and so cheaply. Really, Biovac, what are you actually trying to do? And I think, what COVID has proven to us is that, with a lack of geographical diversification for manufacture, then we are really in trouble. And I mean, the export bans that we've seen from countries that are large manufacturers, has been a limitation. And the speed with which countries that have the technology and have the platform have been able to give their populations access, has also proven that. So which essentially means that, whilst we can follow the normal dynamics of business about scale and, let's get things from wherever they are the cheapest, when you deal with health matters, then we really need to look at risk of supply. And with vaccines, there is a risk of supply. Now we're seeing it with COVID. But I can tell you, even with routine vaccines, Tabo, there's a risk of supply. There are children out there today that are not accessing childhood vaccines, against pneumonia, against TB, against many other things for which me and you have been vaccinated.
Right.
And that is a problem, and it just adds to Africa's problem. We have many other problems, health being one of them.
Yeah. So this question, I'm sure, was put to you when you start Biovac, to say, so how are you going to deal with the question of high production costs? For example, how far are you from being in on par in competition with the biggest guys like India, for example?
Absolutely. One of the things, so just to give you a bit of history, so Biovac was actually the concept of government. I mean, at the moment, it's a public-private partnership, so between private sector, ourselves, and government. And yes, the economics were not working, and to some extent, our naivety, I must say, helped, because we went in there being extremely passionate in terms of developing an industry. And within the few years of establishing it, and then we started scratching our head and said, oh my word, this is quite difficult. But, where I'm saying naivety helped is that we were in it, so we couldn't get out of it, and therefore we needed to make it work. We needed to make sure that we make it work. If we knew what we knew, we probably wouldn't have started, and we wouldn't have a Biovac today. So to some extent, going in a little bit blind helped, and we've been able to make sure that we structure the company and get access to funding for those that can be able to empathize with the business model. If we go to a traditional bank and say, well, we want to expand facilities, they would laugh at us. But we have to go to funding sources that would understand, the social impact and the long-lasting impact that vaccines would have. And that's what we've done thus far, Thabo, and I'm very happy that, when we announce deals like today, it's not that, we were born yesterday, but it's the long and hard work that we've been doing and proving ourselves that it can actually happen in Africa.
Yeah.
And to have the confidence of multinationals like what we announced today with Pfizer on, a very, very much needed vaccine on the continent, I think means that, if Biovac can do it, others can do it on the continent.
Right. Now, the question is, and you tell me if my understanding is correct here, as far as the value chain steps are concerned, you're coming in at the fill and finish and package and label capacity, which has been well developed here in South Africa. And many are asking, so when are we going to get to the drug substance level at least, or maybe even the antigen production level?
Absolutely. I think that is a very fair question, and it should be asked, and it should continuously be asked, because we can't say that we have arrived, by just doing fill finish. However, we cannot underestimate the effort that fill finish does, and I'll tell you of two aspects that it helps. Other manufacturers have the drug substance side, which is the API, the raw material side, but do not have capacity for the downstream side. Now, in order to get the vaccine, you need the whole value chain. You can't work with 50% of it. You can't have a half-baked bread. You need to bake the whole bread, for somebody to be able, for it to be edible.
Indeed.
And so the latter part of the value chain, being the fill finish, is equally important, and I must say is not as simple as it is made out to be. It is in itself complex. So number one, it is an important part of the value chain. And secondly, there are aspects, and we've seen that globally, where that has been a bottleneck. Pfizer in itself has also partnered with other multinationals, like the likes of Sanofi and Novartis in Europe, in acquiring fill finish capacity. So number one, we are not unique. It's not like only Africa is doing fill finish. That's happening elsewhere, but it's an important part of the value chain. Coming to the upstream side, and as I said earlier, we, Biovac, and through our board, have made a determination that that is something that Biovac must have come hell or high water. It may take us a bit of time, and we obviously need to work with the right partners to get us to that level, but we do need to have the API, or what is called drug substance manufacture, for real self-sustainability in time. We need to do that, and through with the African Union and the Africa CDC, the WHO, and other partners who share the same vision, I don't think we can fail in this mission. Whilst we don't have it today, but it's something that we're not going to rest our laurels. We must have it in the country, and we must have it on the continent for self-sustainability.
Yeah. What level then of commitment from the leadership do you need for us to be able to say we are getting into this space?
Yeah. So so we need a few things for that to happen, Thabo. So let's talk about what can governments do, okay? And we know our governments have limited resources. I think our ask from governments is to have a long-term vision, where you can have line of sight as to, if you enter into an agreement to purchase vaccines, it needs to be long enough for African manufacturers to be able to pay the bills and pay the loans that they would have raised. Without that, it's extremely difficult for companies on the continent to raise money, because who's the buyer, and how long? You can't enter into only a 1-year contract and expect to raise, 2 billion rand. How are you going to pay that? So I think our governments have, if they can give us reliable and sustainable tenure, on the continent, that would certainly serve us as a business case. So that's on the government side. On the private sector side, there has been, and I'm talking about companies that are in Europe and anywhere else. There is a partnership model that can be had without threatening, because people are scared. Oh, my word, if I share my technology with Africa now, they're going to take my IP and do something else with it. I think what is important about technology transfers, whether you're talking about the API or whether you're talking about the downstream side, those are based on trust. It has to be based on trust. And once you base that on trust, then nobody has the opportunity to give the other one a raw deal. And so, the tech transfer partners have to have the confidence and the trust that Africa can do it, and I'd like to believe that, we are one of the parties that can show that it can be done. And with that, with a combination of the long-term commitments from governments, I think we can make it work. And we can then be able to raise funding even independent of government.
Right.
We're not necessarily asking for governments to pay. Governments are stretched, but if we can work out a model that can work, then and there are models out there, we don't have to start from scratch in terms of thinking what is it that we need to do.
Let's talk a little bit more about that when we come back from the break. Biovac Institute CEO Dr. Morena Makhoana with us tonight. You're a part of the conversation. You can send us your questions and comments on 072-110-5584, or you can tweet us at Newzroom405. In Focus continues in a moment. Welcome back to In Focus tonight. The conversation around, of course, the announcement made earlier on that Biovac, Pfizer and BioNTech now in partnership to be able to deliver to the African Union close to 100 million COVID-19 vaccines by 2022. A milestone indeed in terms of vaccine production and availability, rapidly so, of course, considering the vaccine apartheid that we have been talking about as soon as the pandemic hit. But we're talking broadly now on what are the measures that need to be taken for Africa to be able to have its own successful domestic vaccine industry. Let's get your views tonight on Twitter at Newzroom405, or otherwise you can send us your comments and questions on 072-110-5584. So before the break, we're talking about some of the factors that can come into play when we want to set up our own vaccination manufacturing industry here in Africa, but in South Africa in particular. Talk to me then about the technology platform that we are looking at, and whether it is there or whether we are building towards it.
Yes, one of the things that we're extremely proud of today, Thabo, is around this mRNA technology. So I think, just to put it into context, that last year, this time, it was a technology that was not widely spoken of. I think within the vaccine community, there was even skepticism around the mRNA technology. And only in December of 2020 did we get a validation globally that this technology can work. And not only can it work, that it can work extremely well. So in December, both Pfizer and Morena, and Pfizer with BioNTech, their partner, did prove that this technology can work. And I think even with us that are more technical, our eyes got wide open and said, okay, what is actually this technology? And so, 7 months post that validation, Thabo, I mean, the fact that we can say that Africa is going to manufacture the latest technology, I think is something that we should all be extremely proud of. And so it's a technology that I think, I will often say that we've all undergone a crash course in learning. It was a technology that actually a lot of those that were involved in it, like BioNTech and Morena and others, they were actually not using it towards infectious diseases. They were actually using it towards cancer treatment. That was actually a lot of where it was actually used. Now, when SARS-CoV-2, which is the virus that causes COVID, once we learned of it in January, and that's how the companies then adopted this technology and said, well, can we use it for infectious disease? And now, obviously 18 months later, we are much wiser in terms of its use and how rapidly it can be. So we're extremely proud of the technology. I mean, it's fairly new in terms of how it works. And, I'm sure your listeners may know it uses a genetic material that sends an instruction into the body. And in that way, I often make the example that it's like a letter being sent, that's covered by an envelope that sends an instruction. That's essentially what happens. You get jabbed by this letter that has an instruction, and then the body then sorts itself out in terms of building the immunity. So it's very, very innovative and very new to the vaccine world.
Now, you mentioned earlier on the whole question of scale, and part of the reason why 99% of our vaccines are imported into the country is because there has been this question of, well, how much demand is really going to be there? And so if we are to start our own industry, how much really are we going to produce? Are we beginning to see at least some emerging strengths as far as an enabling environment is concerned on the question of scale?
Yes. So when you talk about scale, certainly when you look at, let's just stick to COVID-19. There is a demand. We have 1.2 billion people on the continent. So, and with the African Union, I must say one of the entities that must be acknowledged is the African Union and the Africa CDC, because they have come together and said, as Africa, we must make it work. And they've raised funding independent of others that says that, they must buy vaccines on the continent. So talking about the demand element that I spoke about earlier, I think we're starting to see signs of Africa saying that it wants to take care of itself. I would just urge them and all African countries to extend that not only to pandemic elements, but to routine vaccines, because that would be the sustainable model. Coming to your direct question about scale of manufacture. What is interesting about this particular technology, and I'll make an example, Thabo, that other platforms that have been there for many, many years, for the last 20 to 30 years, and I'll just make a simple example. Where you need, let's say, a 5,000-liter big fermenter in order for you to run at scale and for you to be efficient and to be cost-effective. You can imagine what a 5,000-liter looks like, just imagine a little bit. So a lot of the companies out there that are large producers would produce in the traditional manufacturing at a scale like that, 1,000 liters, 5,000 liters and all of that. Now with the mRNA technology, what is interesting about it is that what the companies have done is that instead of setting up these big tanks that will take forever to even be able to get online, is that you set up multiple small scale, let's use tanks in this case, okay? And let's assume that you set up multiple 20 liters, that would end up getting you to the required scale. That then makes it easy for you to reduce or expand. When you expand, you just add another 20 liter and another 20 liter, just, side by side. That innovation as well will help with scale on our continent sometimes when you find that maybe the demand is not predictable. So scale is an important thing. Even in mRNA, I certainly won't undermine it, but it certainly with this technology makes it a little bit more adaptable, such that one can be able to scale down or scale up or actually scale out, which is quite important.
And of course, then the other factor, we've spoken about the value chain steps and where we can actually come in, but we also want to talk about country-specific production and demands at this particular point in time. And as far as Biovac is concerned, are you looking at the entire continent, or are you just focused on the needs that we would have here in South Africa?
So yes, particularly with this transaction, I mean, the agreement with Pfizer was that it has to go beyond South Africa. I mean, we know the populations that are out there. South Africa has 60 million population, Nigeria has a large population, Ethiopia, DRC, and others have much, much larger population than what South Africa has. And for us to do two things. Number one, to be able to access, and by access, I mean that people should actually get the vaccine. It's important that we just don't look at the domestic market. I think that's important. And secondly, it's important. I mean, so for exports, it's also quite good for even our own country in terms of the trade balances. And Biovac always had the need to be able to be an exporter. At the moment, with the vaccine that we produce for the pediatric ones, we've been looking, we've been mainly homegrown. And we always had the desire, and we now have the opportunity to actually be able to supply other countries. So, I mean, this is a wonderful opportunity for the countries that would be a recipient, a wonderful opportunity for South Africa to showcase as an exporter, and for our own company as well.
Of course, the question, of course, comes down to this particular one. Can Africa make its own vaccines for Africa? Is a domestic industry possible? And what level of strength are we at right now to enable that to happen?
Yeah. I would say yes to all of the above. However, we should not be compared with North America, Europe, China, or India as I'm saying the yes. Because other people will say, well, but this has happened in the US, why can't you do it? If this has happened in China, why can't you do it? So it is possible that we can do it. However, we do need to understand where we are and that the starting point is not the same. And that's important. The starting point is not the same. We have countries, I mean, and that, your viewers know well of Europe and the US. If I can make an example of the US where they have hubs. If you take the eastern part of the US in the Boston area, there's a biotech hub. You take the Silicon Valley, there's a biotech hub. Now, and the multiple companies there, and that ecosystem allows for skills to be, to go up and down, allows for companies to share a lot of knowledge. And so those are the things that are below the radar that people may not be aware of that would make it happen for Africa to be able to do it. The ecosystem is important, like stable energy generation. I mean, you won't believe the importance of that to external investors. How stable is your energy? How stable is your water supply? Where are you going to get the skills? How are you going to retain those skills? All of those things are something, that's not things that are well spoken about. And when partners look at us as Africa, and they choose where they need to go, we must bear that in mind that those are the criteria that they're actually looking at and why they will put their money or they will put their, or they will partner with this company and not that company, or with this country and without that country, or not that country. And so what I'm saying is that I'm saying yes to above to all of that. However, we need to go with our eyes open, knowing that what happens in North America, whilst we may look at it, and say it's certainly possible, we must understand that our starting base is very, very different from other countries.
Dr. Morena, I appreciate your time and thank you very much for joining us tonight here on In Focus. Biovac Institute CEO there, Dr. Morena Makhoana.